So I grew up in Canton, Ohio. It's the home of the Pro Football Hall of Fame, and I did all my medical school training and residency in Cleveland, Ohio at Case Western Reserve University. For fellowship, I actually moved to Charlotte, North Carolina, and I love North Carolina and started to look at different opportunities that would, one, both allow me to utilize the training and the skills that I had brought, but also hopefully land in a town similar to where I grew up. Greenville offered a lot of the similar sort of community-based aspects and Little League games that I still love going to now, but it also gave me an opportunity to be able to be within the patient population that I serve and see those people, again, out at the grocery store, out at the ball field, out at the airport as we travel through town. And it's meant a lot to me just in the practice since I've been here to be able to take care of actual people that I know and provide them with good orthopedic and well-trained care. I came into medicine because I wanted to be in a service-oriented career where I would have the opportunity to help people grow and improve their lives and be able to improve their quality of life. My family didn't come from a family of doctors. I was actually the first one in my family to do that. And so the ability to go through the educational process was a very welcome challenge and something that I really did enjoy. So I love orthopedics because I get to take real people who, prior to them seeing me, either had former lives as athletes or runners or walkers, parents, workers, who for whatever reason, whether it's a progressive disease, whether it's an injury that they've had, can't continue to do that. And so with the skills that I've been able to develop and some of the newer techniques that come out and that allow for less invasive delivery of care, whether it's joint replacement, outpatient total hip replacement, whether it's minimally invasive carpal tunnel or arthroscopic treatments, allow those people to get back to the things that they love to do and allow them to re-enjoy their life and really establish a better quality of life as they go forward and recover from whatever it is that's taken them away from what they enjoy. I've been part of Orthopaedics East now for almost 10 years, and it's a wonderful group of highly trained individuals. I'm fortunate enough to have partners that are literally right around the corner and right down the hall whenever there is something that comes up that either requires additional assistance or possibly another point of view, or maybe just a different degree of subspecialization that allows me to facilitate delivery of care to my patient in a relatively easy transition for them. We're in a position where a lot of people come from a long way away to come see us, and we're very fortunate and I feel very honored frequently that people do come that far to come see us. And it means a lot to me that I have such a good, well-established team around me to facilitate their definitive care, even if I'm not the one that's going to be providing that for them. Orthopaedics East has a long history of delivering top-notch orthopedic care to Eastern North Carolina. To that end, we want to continue to develop new techniques and stay on the cutting edge of delivering top-notch orthopedic care from now and into the future. We're lucky to have a very well-established, large medical institution that we can do some very complex and complicated surgical procedures, as well as the surgery center that allows us to advance our outpatient surgery delivery and to really focus on the people that we serve as opposed to having them worry about things like traffic and parking and the logistics that go with that. So good patient care to me really means taking care of the whole patient, and that comes from beginning to end. One of the things that I love about orthopedic surgery is we do not only surgical treatment, but also non-surgical treatment. And so I can see somebody from the beginning of their arthritis process all the way up into and through the end. And certain people I will see for 5, 6, 10 years. So I get to know them, I get to know their families. Good patient care really takes on not only treating the patient and their problem, but also the people who are around them and helping them coach through what can be some very difficult times in the setting of trauma or some very joyful times as we transition somebody's pain that's limited their ability to even do simple things like walking out into the community and back to the lives they love.